30% of the cycles are egg freezing. So 70% are IVF. So this is the number. Before the COVID-19, this number is something around 15 to 17% of egg freezing. So the market has doubled in terms of egg freezing. In our group, the clinics in the southeast of the country are doing around 35 to 40% of egg freezing. Our group recently bought many embryoscopes, many time-lapse incubators. So we are now around 12% of the cycles in Brazil, and our clinic have around 50 to 60% of the embryoscopes in Brazil.
What if 30% of all of your egg retrievals were for egg freezing? It's not happening in the vast majority of fertility clinics, but it is happening somewhere. According to my guest, it's happening in Brazil, and he talks about the technology they've invested in that he sees as necessary to grow and serve that egg freezing population. His name is Dr. Dantas Martins. He goes by Marcus Dantas. He's an MD by training, but he doesn't practice clinically anymore. He's the chief operating officer of Fert Group. He says they're the first private equity-backed informed fertility clinic network in Brazil. They're buying clinics and IVF labs across Brazil. And even though they were only formed about a year and a half ago and have 10 clinics, their 10 clinics are doing 12% of the IVF cycles in that country. Brazil's a country of 200 million people, the 10th largest economy, and they have 175 fertility clinics doing roughly 42,000 IVF cycles, 30% of which, according to Dantas, are egg freezing. He shares how this group was formed and what specific technologies they've been investing in and how they plan to further grow the market. If you're in the IVF space in Latin America, or if you're anywhere that wants to grow your egg freezing program, enjoy this conversation with Dr. Marcus Dantas.
Today's advertiser helped make the production and delivery of this episode possible for free to you. But the themes expressed by the guests do not necessarily reflect the views of Inside Reproductive Health, nor of the advertiser. The advertiser does not have editorial control over the content of this episode, and the guest's appearance is not an endorsement of the advertiser.
Dr. Dantas, Marcus, welcome to the Inside Reproductive Health podcast.
So thanks for having me, Griffin. It will be a pleasure to be with you today.
I want to ask about what it's been like being one of the first groups in South America to go with private equity. I want to get an idea of how growth in different continents can inspire growth in the IVF space in other continents, because I think everyone's doing some different things that will be adopted by others, and I would like to hear about that from you. But before we go into that level of detail, will you lay out for us an overview, a bird's eye view of what the IVF marketplace is like in Brazil right now?
Yeah, Brazil, as you know, is a huge country. So we are more than 200 million people living down here in Brazil. We are among the 10 biggest economies in the world. Inflation is under control. But of course, as a developing country, we are facing significant challenges, especially regarding that almost half of our population is either poor in the low-income group. The Brazilian market for reproductive health has its own set of challenges. Brazil performs around 48 to 50,000 IVF cycles per year. About 60 to 65 of these treatments occur in south and southeast regions of the country. São Paulo is the biggest city and also the biggest state of Brazil. São Paulo alone accounting for approximately 40% of the IVF cycle. So the cycles are concentrated far away for the rest of the country. So we are facing a challenge and also an opportunity here in Brazil. There is, of course, a significant opportunity to expand into other parts of the country, and we are actively pursuing this. Another important point is that the government does not pay for IVF treatments, except in few centers at specific locations. Around 25% of the Brazilian population has private health insurance, but these plans typically do not cover fertility treatments. So leaving patients to pay out of pocket is completely self-paid. So we think we have some challenges on it, but also opportunities to partnerships with corporations. And for us, a network of clinics spreads over the country. I think it's a good opportunity for us too.
Is there a business case to be made for expanding to care? Not just an ethical case, but is there a business case to be made for doing more IVF cycles in Brazil? Very often, when you have a population in certain countries with an economic disparity, the rich get healthcare and those that can't afford it simply don't, and has been that way for many decades in many segments of healthcare. Is there a business case to be made for why IVF should be made more accessible to those that can't afford it?
Um, I think that the opportunity here in Brazil is not to lower the prices because of the low income of the population. I think that democratize includes spread clinics all over the country. So it's very common in Brazil that people in another states take a plan to come down to São Paulo to have a treatment done. So I think that opportunity it's not only democratizing as lowering price, but also make the treatments done wherever the patients are.
And what does that look like? Does that look like training more doctors? Does it look like training more embryologists? Does it look like automating the IVF lab? Does it look like having nurses do certain things like IUIs? Tell me more about how you would expand into different parts of the country.
I think that we have two important barriers. So one of them is the price of the IVF treatments. And the other one, I think that the gynecologists in Brazil stay with the patients for a long time before refer to a specialist. So I think that we have opportunities in educational issues, not only for the patients itself, but also for the gynecologists. I think that they are stay with the patients for a long time. And of course, we have to have more doctors doing IVF. We have to have more embryologists, and we are investing on it. We are investing in medical education and embryologist education because to increase the number of treatments here in Brazil, have more people doing it along the country.
And so what technology do you see as being necessary to aid you in doing that, to make this all possible? And not just technology that might be currently available, but technology that might not be available yet. What kind of technology do you need?
I'm particularly part of my executive career. I have spent some time visiting health companies in Silicon Valley. I have studied data science at Oxford, Columbia, and many other executive courses here in Brazil. So I'm especially interested in technology and I think breakthrough in IVF. For example, our group recently bought many embryoscopes, many time-lapse incubators. So we are now around 12% of the cycles in Brazil, and our clinic have around 50 to 60% of the embryoscopes in Brazil. So we are investing in it. We believe that technology could improve the results and could improve the access for the treatments. We recently established a partnership with Homu. I don't know if you have heard about Homu. Homu is an incubator and accelerator for biomedical startups. dedicated to developing solutions for the IVF market. We are the only site in Brazil developing and testing these technologies. For example, remote echographies for control the cycles away from the IVF lab. So we are investing a lot in technology, and we believe that it can make the market more accessible for people who lives away from the biggest cities in Brazil.
Yeah, Homu, that's Santi's
Yeah,
incubator, isn't it? Santiago Mune.
Yeah.
And so they invest and they incubate in various technological solutions, the fertility space. And so are your group, is your clinic group a sort of tester for those different companies that are in the Homu incubator?
Yeah, we are testing some of the new technologies. For example, in automatic vitrification, we are planning to test the remote echographies. So we are now the only site in Brazil to do it.
Tell me more about that.
And I think that if you want to spread technology, if you want to spread clinics, one of our pillars is to have a national footprint. So we believe that a big network of clinics here in Brazil, you have to be all over the country. Brazil is a continental country, so there are long distance to travel to have a treatment done. We believe that, for example, if you can have remote control of the cycles with gynecologists in a lot of cities around the country, the patient just need to travel to retrieve and to make, for example, what embryo transfer. So the patients can do almost all the process away from the clinics, and we are spreading many sites where the patients can do it.
What technologies that you've been testing, either through Homu or other technologies that you've been testing, what technologies have you been pleasantly surprised by?
We have started a partnership with Future Fertility, for example. We are now offering Violet and Magenta, the two algorithms, in some of our clinics. So we did a retrospective study with thousands and thousands of egg image, and we believe that's something new on it. For example, if a patient come to egg freezing, and you can tell her how many percent she can have an embryo or a baby, I think it's something important, something important in the decision process to have more eggs for the future or not. I think it's a technology. We are testing it. We are very excited to move forward, and think there is some value on it.
What about it has been pleasantly surprising? Is the performance been better than you thought it was going to be? Has it just been you've been able to use it in more ways? Tell me more about that.
I think that the accuracy is not perfect. It's not we expected, but I think we are moving forward. We are increasing. We are submitting more and more images to the system, and I think that the accuracy will increase step by step. And I think in the future you can put together embryoscope image, artificial intelligence images, and the embryo biopsies. I think in the future we will put all together and have better results in terms of IVF treatments.
What will these technologies do to scale care? Is this just about improving the quality of care, or is this some combination that will lead to being able to see thousands more patients than you're currently serving?
I think both. I think we are very worried about quality. Quality is another pillar of our thesis. Usually people, when someone heard about a private equity in the markets, for us to have lower quality. No, it's not. It's really not. The the team is always worried about stay with the most quality that you can have, and also pick some technologies that can spread the treatments around the country. So it's quality, and it's also to have more and more patients doing treatments. We have to do it. We are facing a problem worldwide about built families. We think that reproductive techniques, there is a place for it on it.
Tell me more about private equity and your group's partnership with private equity. And I guess let's start off with a little bit of the history of Fert Group and the size of the group, how many doctors you all have, how many offices in how many cities, how many IVF cycles that you do, and then how did private equity come into the picture?
We are just starting. The first acquisitions were 1 year ago. Our clinic, I have worked as executive director in a group in Rio de Janeiro. So our group was the first one to be acquired. Since then, 10 clinics in Brazil. The Brazilian market has around 175 clinics spread over the country. We are now 10 of these clinics, but we are doing 12% of the cycle. So our clinics are not the biggest, but among the 10 to 20 biggest clinics in Brazil. We are around 20 clinics at the end of 2025. So we are just starting. It's a new culture in Brazil. The clinics are, most of them, familiar. The owner has running the business for a long time, so it's a challenge to move on. But I think we have an extraordinary team, and I think we are doing a very good job here in Brazil.
If I'm understanding correctly, then this is private equity coming in and forming a network and acquiring and consolidating existing clinics, as opposed to something like a Shady Grove or a Boston IVF in the United States, which were a group themselves and then got larger and then got financial partners. This is a private equity partner coming in and helping to form the network and consolidating and acquiring networks. Is that right?
Yeah, that's right.
And so how did you come into play for all this? Because you're the chief operating officer of the group now. You're also a medical doctor by training. How did you come into the role that you're in now?
I used to be a doctor. I'm not a doctor anymore. I graduated medicine in 92. I think I had a very good career on it, but the turning point was an MBA in finance. So I start to work part-time as executive director in one of our clinics. So we opened a second one, and we are thinking of be part of a huge group of clinics, a network of clinics. And it happened 1 year ago. So I'm the COO of the group. So here I am as the COO of the group. I'm traveling a lot. Only to visit our clinics, to running our clinics, but find new clinics to be part of our network. As I said, we are just starting. We are working very hard here down in Brazil to have the biggest network in South America. And of course, with pillars of democratize the access, quality is very important for us. And of course, I think we are doing a very good job here on it.
And about how many cycles, IVF cycles, are done in Brazil in total per year?
48,000 to 50,000.
Okay. As a group that's emerging, one of the challenges that has happened in other countries with private equity is making the standard of care uniform across the network, because this doctor practices this way in this city and this doctor at this clinic practices a different way in a different part of the country. How are you building the infrastructure to have quality control and to have a certain replicable standard of care?
There are a lot of things to do. Of course, it's not easy. For example, now we are rolling out the electronic medical records for all the clinics. Each clinic of our group will be at the same system at the end of 2024. So at the end of this year, we'll have everybody at the same electronic medical record. I think it's a first step to have everybody together at the same platforms. One of the things we are doing to integrate it, all the clinics.
And do you have any kind of physician advisory board, or how do your lab directors come together? How do your doctors come together? And then what are there protocols being made that they follow?
Yeah. We have a medical, he and his group is working a lot in medical protocols. I think it's the doctors can prescribe the medicine that they believe, the drug that they believe. But of course, as a group, you have to have some protocols on specific points. For example, egg freezing. I think that Edson Borges is a medical director. He is the former president of our Brazilian Society of Reproductive Health. And he's doing a very good job here with our group. And we think we are moving forwards as fast as we can to have our protocols and educate also the doctors with some of our protocols.
I didn't realize that this timeline was so recent, about a year and a half ago. Is Fert Group the first private equity backed network in Brazil?
Yeah, it's the first one and is the only one here in Brazil.
So, I think Eugen has maybe a clinic or two in Brazil, or has some clinic presence in Brazil. No, have other international clinic networks come in to Brazil and have a little bit of presence there?
Yeah. Brazil, there is a second network of clinics, and some foreigners, private equity, are coming to Brazil and make some investments in specific clinics. But our group is the biggest one and we are buying week and month by month new clinics, and we are planning to be the biggest one, and not only the biggest one, but also based on quality. And we are trying to really be the biggest, and also not the best is something to say, but we are very worried about the quality of our clinic. So someone are coming down here to Brazil, but I think we have a presence, a very important presence here.
So this started in late 2022 or early 2023. What was true about the market conditions in Brazil that have now has been the right time for private equity to come in and start buying clinics wasn't true 5, 10, 15 years ago?
I'm not sure the right time. The markets, the IVF market's flat. It's a behavior all over the world. There are less families. There are less women having children. So we have to face it. But I think we have a lot of opportunity on the other hand, because egg freezing is increasing a lot. I think that the COVID-19 made a challenge, made a different way of thinking about the future. So more women are looking for us and looking for each clinic in the world to have her eggs freezing. So I think there is a huge opportunity on it. I think that the economy is of course we are facing our problems in economy, but Brazil is, as I said, is a huge country, is a huge economy. So I think that you can offer as a benefit, for example, for each large company to offer for her employees to have her egg freezing for the future. I think that there is an opportunity on it in Brazil.
How much of this is speculation and how much of it is happening now? So how many egg freezing cycles does your whole group do? Is it a couple hundred or a couple thousand? For just egg freezing retrievals.
Yeah, I think that in Brazil, 30% of the cycles are egg freezing. So 70% are IVF. So this is the number. Before the COVID-19, this number is something around 15 to 17% of egg freezing. So the market has doubled in terms of egg freezing. In our group, the clinics in the southeast of the country are doing around 35 to 40% of egg freezing. So the biggest city, more egg freezing than small cities. I think that if you can spread clinics around the country, you can make a different way of think, and of course offer egg freezing in different parts of the country. So I think there is a huge opportunity on it here in Brazil. And of course, all over the
It
world.
sounds like
Yeah,
it.
I'm sorry.
Why did that number double as far as you can tell? Was it just was there money coming into the marketplace because of inflation elsewhere, and then other people were to amass more money and decided to put that to egg freezing? Did employers start covering it in some way? Why did that egg freezing market double in just a short period of time?
I think that the main trigger, the COVID-19, I think that women are thinking about being mothers, but they are buying insurance to do it, would do it in the future. So I think it's a behavior. It's just behavior. And I think it's happening all over the last in some countries, but I think it's a tendency in the world.
Has that behavior sustained since COVID? Maybe you saw a spike in 2021 and 2022. Has that increase continued in 2023 and 2024?
It's stable for the last 2 years, but it's around 30%. So I think doubles since the beginning of COVID-19. I think it's come to stay with us. Of course, as the treatments are completely self-paid in Brazil, if you offer as a benefit, you have a huge opportunity to increase this number a lot. And we are working on it. I know that in the US, it's many companies are offering it as a benefit, but in Brazil, it's not common. So it's cultural. I think it's come in a near future.
Is that part of the reason why you're using Future Fertility as well? I forget if it's Magenta or Violet or which product they use for egg freezing, but is the number of egg freezing patients, does it have anything to do with how you use Future Fertility, or I guess vice versa? Do you use that to grow or serve the egg freezing patients in some way? How do you use that?
Yeah, Violet is the algorithm for egg freezing. And I think it's a tool. It's important to offer something. You can read a report made by artificial intelligence, and you can make a decision. So I have enough eggs, or I do not have enough eggs, and I will do a second cycle. So I think it's important to make a decision to have more eggs or not. I think it's important. Of course, it has to develop a little bit more, but we are working with them, and we are sending egg images retrospectively. And I think the model will be better day by day, step by step.
And why time-lapse imaging? That sounds like a big investment to do so early on, and it sounds like you made a big investment in time-lapse imaging. Why did you choose that?
I think that it's another tool that you can, the safest environment to the development of embryos. I know that there is different cultures. Europe use time-lapse a lot, and US do not. So in Brazil, of course, it's a technology, it's expensive, but we think there is a place in the future when each of these tools will talk together, and we have to increase it to make the results better in terms of IVF. So I think that time-lapse, including the artificial intelligence technology, will do a job. on it. So we are investing on it, and we think that it will be an important tool for better results in terms of IVF.
I'm imagining your conversation with your investors, and they're thinking, Marcus, hang on, we just bought a bunch of clinics. We want to buy many more clinics. You want to buy all of these time-lapse image machines. How did you convince your investors that it was a good idea?
I do not have to convince. They are completely convinced that we have to work with quality. If you don't deliver a baby for someone who is looking for it, you will fail. So we are investing in as much technology as we can to have the better results, to be the best network of clinics. And of course, the return on investment is a consequence of doing a good job, or invested in quality, or invested in democratize the access, or have more and more people doing IVF, freezing their eggs. I think it's a consequence.
You talked about the opportunity in Brazil for employers to pay for the treatment of their employees as a benefit. Is this an opportunity that you see Fert Group approaching employers directly for? So are you all contacting employers and trying to work out arrangements with employers, or is this something that you're hoping somebody like Progeny or Carrot or Maven or one of those companies will come into Brazil, or that a Brazilian company will emerge in that space? Is it direct that you're going, or are you hoping that some sort of employer carve out insurance company will fill that void?
Yeah, I'm not sure, but we are working on do it by ourselves. I think as a network of clinics spreads over the country, we can offer in a lot of places, and you can make the arrangements by ourselves direct to the companies. I think that there is Brazil is different from US. So you have a lot of companies doing the negotiation with clinics and groups and corporations. In Brazil, do not it yet. So we are doing it by ourselves. Of course, it's not easy. I think we will have it on the near future.
I want to give you the opportunity to conclude on whatever thoughts you would like to conclude our conversation with, whether it's improving quality, whether it's introducing the new technology, whether it's the IVF market in Brazil and Latin America. What do you want other IVF providers and lab specialists and fertility clinic network executives, both in South America and in other parts of the world, to think about?
I think that it is what it is. It's not easy to wake up every day in the morning working hard. So we have a extraordinary team with us, many people working hard every day to make things done. I think Brazil is a huge country. As I said, we have a lot of opportunities. We have a lot of people living down here. And I think we are the biggest country in Latin America. We are the biggest economy in Latin America. And I think that we have to start from here, from Brazil. I think Brazil will make the IVF cycles more affordable. That we will have an important level of responsibility as the first private equity group here. But we think we are really doing a good job, and I'm expecting good things from Brazil and from this private equity group network of clinics.
I look forward to bringing you back on in a couple of years and hearing about the progress and hearing about the expansion. And I think talking more about that expansion in egg freezing, because 30% of the total retrievals is a high number. And I think Brazil might be an outlier in that. And so I think that's interesting. And I'll be interested to follow your progress some more. Dr. Marcus Dantas Martins, it was very nice to meet you. Thank you for coming on the Inside Reproductive Health podcast.
Thank you very much, Griffin, to be with you today, and have a good day. Our group recently bought many embryoscopes, many time-lapse incubators. So we are now around 12% of the cycles in Brazil, and our clinic have around 50 to 60% of the embryoscopes in Brazil.
Today's advertiser helped make the production and delivery of this episode possible for free to you. But the themes expressed by the guests do not necessarily reflect the views of Inside Reproductive Health nor of the advertiser. The advertiser does not have editorial control over the content of this episode, and the guest's appearance is not an endorsement of the advertiser. Thank you for listening to Inside Reproductive Health.